Hello, everyone. Welcome back to another session of Fundamental of Nursing. I, Anastasia Jerwa, will be dealing with a new topic of Fundamental of Nursing, which is known as the primary health care and its delivery. In this session, we are going to learn about what a primary health care is, what are the services that these primary health cares will provide, and what are the roles and responsibility of a primary health care giver. So, here, before we move to the topic, I just want to give you guys a brief introduction to what this primary health care is and how this idea or the method of providing care had been chosen. So, here, with an increased recognition of failure of the existing healthcare services to provide healthcare to the people around them, so what they did here is they have tried to find another alternative ideas, or we can say the methods to provide these healthcare to the people. So here this primary healthcare has been one of the method which had come into the limelight in 1978 following an international conference which was held in Alma Ata, USSR. So now let's move to the definition of this primary health care. So primary health care is an essential care that has been made accessible as well as acceptable to the people around the globe through their full participation in it, and as well as at a cost which is affordable by the community members or by the country as a whole. Now let's move on to the purpose of primary health care. So why do we provide this care? Here there are four main purposes. The first one is to increase in the life expectation. So here, this primary health care is being given to the people all around the world or mostly in the communities. Why? In order to improve their health status. If these healthcare is given to the people at the right time, it will obviously help them to maintain their health as well as to promote their health. And also, if the person is suffering from any kind of condition, through these primary healthcare, we can provide the necessary treatment to the person in order to help them regain their health. So, in this way, by providing these primary healthcare services, we will be able to increase the life expectation of a person. So the next one is the improvement in the nutritional status. So being a healthcare provider, it is not only necessary that you only need to provide care to the patient if he or she is ill, but here it is also a role of these caregivers to educate the client about the various lifestyle modification they should follow in order to improve their health. So here these caregivers will also be educating the people on the right kind of food they should consume. It is very necessary that we must consume all the nutritious food in order to have a good nutritional balance. So here as a caregiver, it is our role that we must educate the client to have a good balanced diet or to consume the good nutritious food in order to improve their nutritional status, because if this nutritional status is not maintained, it can lead them to suffer from various nutritional deficiency, especially for the young ones where they are more prone to develop protein energy malnutrition such as kwashiorkor or marasmus or any other disease which can cause because of deficiency of the nutrients. The next one is the provision of basic sanitation. As we all know that in order to maintain our health or to improve our health, it is not only important that we should make lifestyle modifications, but it is also important that a hygienic pattern must be maintained. So here it is the responsibilities of these primary health care givers to make sure that people are having a good sanitation. As we all know that even through this, it can lead us to suffer from many communicable diseases. So in order to prevent them, we must make sure that they have a good sanitation. And the last one here is the development of the manpower as well as the other resources. Now, moving on to the elements of these primary health care. Here, the Alma Ata Conference has outlined 8 essential components of the primary health care, and these are education concerning the prevailing health problem and also the methods of preventing and controlling them. This simply means that as a caregiver, it is our responsibility to educate the people about any diseases which is very common at that particular time or which is spreading at a high rate in that particular community. The first one is the education concerning the prevailing health problems and the methods of preventing and controlling them. Here, as a primary health caregiver, it is our responsibility that we must educate the client about the condition which is very contagious at that particular point of time. For example, as we've all witnessed the period where everybody was at the threat of suffering from a condition known as corona. So here, as we all know that this disease can be transmitted from one person to another, what our role was? Our role was to educate the people about this disease and also about the various methods that they can adopt in order to prevent themselves from getting these diseases. So here we will be educating the people about the various methods they should adopt, such as maintaining 6 feet distance, wearing masks, sanitize their hands. So this is a few things which we can do in order to help them to attain a good health. The next one is the promotion of food supply and proper nutrition. The third is the adequate supply of safe water and basic sanitation. The next is the maternal and child health care, which can also include the family planning. So here we can also provide care to the mother as well as a child, and we can also help the couple in planning their family. We can also provide immunization to the people against major infectious diseases. The next one is the prevention and control of locally endemic diseases. The next one is to provide the appropriate treatment of the common diseases as well as the injury. And the last one is the provision of drugs. So these are the 8 elements of the primary health care. Now moving on to the principles. So here there are 5 principles. The first one is the equitable distribution. The second is the community participation. The third is the intersectoral coordination. The fourth, it is the appropriate technology. And the last one is the prevention. So now let's look at each one of them in detail. The first one is the equitable distribution. Here it is believed that health services must be provided to all the people irrespective of their ability to pay. Whether a person is rich or poor, or whether he or she is staying in the urban or the rural area, it is believed that all of them must have an equal access to these health services, as we all know that majority of the population stays in the rural area. Around 80% of the total population resides in rural area, whereas 20% resides in urban area. But if we consider the healthcare services which is provided, it is seen that it is just the opposite of what the population is. That is, 80% of the healthcare services are being provided to the people who's living in the urban area, whereas only 20% is being provided to the people who constitute 80% of the total population. So what does this primary healthcare do? These primary healthcare aims to bring an balance to the healthcare services which is being provided to these people. Here, their main aim is to provide the equal amount of care to the people living in the rural areas as well as the urban areas. Not just providing an equal amount of these care services to the people, but they also aim to bring these healthcare services near to the people as well as near to their homes. But they also aim to bring these healthcare services as nearer to the people's home as possible. The next one is the community participation. Here, from the name itself, we can understand that the community participation is required in order to make these primary health care services efficient. So, the involvement of the individual and community in promotion of their own health and welfare is an essential ingredient of the primary health care. So, here, these primary health caregivers must try their level best to involve the community while they are planning, implementing, and maintaining these healthcare services besides maximum reliance on local resources such as manpower, money, as well as the materials. So, as I've said, that in order to make this primary health care effective, we need the participation of the community as well. If the community is willing to participate, then only can we provide an effective healthcare services. Here, we must try our best to involve the community while we are planning, we are implementing these healthcare services so that a good result can be obtained. And also, we have seen that in the previous years, by overcoming the cultural as well as the communication barriers, had provide primary health care in ways that are acceptable to the community. So now these trained dyers and the health guides are considered as an essential feature of the primary health care in India. Next is the intersectoral coordination. So, there has been an increasing realization that health for all cannot be provided by the health sector alone. So, the declaration of the Alma Ata has stated that these health sector must work in coordination with the primary health care and aspects of various national and community development, in particular the agriculture, the food industry, animal husbandry, the housing, public works, as well as the communication. So, in order to achieve such cooperation between the two, the countries may have to review their administrative system, relocate their resources, and introduce a suitable legislation so that coordination between these can take place. The next one is the appropriate technology. So, here, in order to make the care which we are providing effective, as well as in order to satisfy the people who are receiving care from our end, it is very important that we must use the appropriate technologies. Technologies such as those which are scientifically sound, adaptable to the local needs, and the ones which will satisfy the buyers as well as the providers. It should be the one which is acceptable as well as the ones which can be easily used by the people. So now let's look what are the various roles and responsibility of a nurse in primary health care. The first one is the assessing of the health status of the individual as well as the community. So, obviously, as a primary health caregiver, it is our responsibility that we must assess the health condition of the people who are living in the particular community. It is also our role that we must provide health education that would help them to promote their health. We can educate them about various disease conditions, about their causes, the risk factors, the symptoms, as well as the prevention which they can follow in order to prevent themselves from suffering from these diseases. We can also educate them about the importance of the exercises and about the importance of the lifestyle modification that they should follow. It is also our role to educate them about the importance of having a proper nutrition, a good water supply, a basic sanitation, as well as the importance of immunization. It is also the role of a nurse to provide care to the mother, to the child, and also to help the couples plan their family. As a nurse, it is also our responsibility to provide treatment to the people who is suffering from minor ailments. As a nurse, it is also our responsibilities that we must try to involve the community while we are planning or implementing any healthcare services in order to make it effective. We can also provide integrated healthcare, such as treatment of emergencies and making referrals. A nurse can also act as a planner and a case manager. He or she can also guide and supervise the client regarding the various treatments which they can follow in order to attain a good health. As a nurse, we can also train as well as supervise the other healthcare workers, and it is also our responsibilities that we must maintain a record of everything we have done. It is also our responsibility to maintain a record of the people living in the community as well as the services which has been provided to them. So here we have come to the end of this topic where we have discussed about the primary health care, its purposes, its elements, as well as the role of a nurse in the primary health care. I hope you guys have got a clear insight of this topic. I will be meeting you guys in another session where we will be dealing with another topics related to this subject. Till then, thank you. Bye.